Okay, good morning or good afternoon, wherever you may be, and thank you all for joining us. And a special thank you to Dr. Charles Andersen for being here today to present on utility of point-of-care fluorescence for detection of elevated bacterial burden in an outpatient wound care setting. After his presentation, there will be a short Q&A, so please do find your chat icon and put any questions that you may have for Dr. Andersen into the chat. We'll try and get through as many as we can in the time permitting. And I'll now turn this over to Dr. Andersen, who is the Chief of Wound Care Service and Medical Director of the Wound Care Clinic at Madigan Army Medical Center in Tacoma, Washington. Thank you and welcome, Dr. Andersen.
Thank you, and good morning to everybody attending. I'm Chuck Andersen. I'm a vascular surgeon by trade. I've been working at Madigan Army Medical Center in a limb preservation initiative for 25 years. And currently I'm chief of the wound care service at Madigan Army Medical Center. On the next slide, you'll see a typical patient, just a little bit of a disclaimer, thank you. So I work for the US government, and it's very important that you realize that anything that I say today is my personal opinion and does not reflect the policy or the opinion of the US government or the Army where I work. On the next slide, you see a typical patient. We can have the next slide, please. You see a typical patient that we're faced with in the clinic every day. And we have to make very difficult decisions based on our clinical ability to assess wounds. So there's some questions that would come up on this wound. Is this induration around the wound? Is this infection? How much bacteria is in the wound? What type of a dressing? How much debridement? All of the questions that we try to answer for each patient we see in the wound care clinic. On the next slide, you'll see how we use the MolecuLight device. On the first standard image, we're able to obtain an image of that wound. Now, the way we run this in our clinic is for each patient, we create a patient folder. And then each time that patient comes back, we enter that same folder, and we're able then to compare images week to week or however frequently we're evaluating that patient. On the center part of that slide, what you see is we're able to utilize the device to actually do wound measurements. And again, that gives us the ability, as that patient comes back, to compare, are we making progress? The light is then turned off, and we then are able to fluoresce the image. Key is this does not require any contrast injection. We're able to just obtain an image, as you see here, which does show some fluorescence in and around that wound. On the next slide. So back to that first patient. So this is the fluorescent image. So the MolecuLight has the ability to detect bacteria within the wound and in the area around the wound. What you see in this image is a very prominent bacterial burden, greater than 10 to the fourth in the wound itself, but you also see evidence of bacterial burden within the skin. So just a little important point, when we see a wound like this, sometimes that fluorescence around the wound will be from drainage. So what we do is carefully wash that skin to make sure that that fluorescence is actually not just exudate that's been on that skin, but truly it's within the skin itself. On the next slide, this is a video that really shows how we use this in the workflow of our clinic. So here we are obtaining an image. We would then also do the measurements. The lights then come off and we're able to then do the fluorescent image. And what you see here is we're obtaining our image, which again shows bacteria around the wound in the callus and also bacteria within the wound. What I'm doing at this point in time is I'm debriding that wound with a curette, and the nurse is actually holding the image so that I can use that image to help guide debridement. So we may, depending on what the image demonstrates, we may focus on a specific area. It's amazing how much you see with the device that you do not see with just looking at it with the eye. Once we do the debridement, then we'll re-image that wound to make sure that we've been able to remove as much as possible of that bioburden. Here we're putting on a biologic tissue. We believe very, very strongly that you should not be putting expensive biologic tissue on a wound that has bacterial load. It certainly, you may just waste a lot of money. This patient is also then being placed in a total contact cast. Our policy is that when we're doing total contact casts, each time they come back for their weekly cast change, we again are able to image that wound, make sure the wound is free of bacteria, and then proceed on with the appropriate dressing and the replacement of the total contact cast. This is just a cartoon showing how we actually use the device in our clinic flow. First of all, this does not take the place of your wound knowledge, your experience, and your clinical assessment. So starting with the basics, obviously a history physical exam, we then clean and assess the wound. We then do our initial scan and assess the bacteria in or around the wound. Next, we proceed on, if indicated, with a debridement. After the debridement, we repeat the scan again to see if we've been able to remove the bacteria within that wound. At that point in time, we now have that additional information that then aids us in the decision making for what our next intervention is. For example, do we use an antibacterial dressing? Do we put the patient on antibiotics? Is it safe to put on a biologic? Do we continue with total contact casts? So it provides us with a very important piece of information that we put together with the other information and then make clinical decisions. The fact that this is point of care, we immediately have that information available. So we're not waiting for cultures to come back. Although at times we still do a culture and wait for the culture to come back, and we may change our antibiotics if we're using antibiotics. On the next slide, you're going to see one of our patients. So this is week 1. This is our first image. And what you see is a very prominent plantar wound. And on the fluorescent imaging, you see an area of significant bacterial burden in that wound. The wound is then debrided, as you see in the center part, and this is post-debridement. This patient then was managed in a total contact cast, coming back weekly for the cast change. As I mentioned, with each cast change, that wound is rescanned, redebrided if appropriate, and if we're using any additional biologics, for example, then we feel that we have the appropriate information where we can use that tissue. And as you see, this patient was completely healed in 6 weeks. On the next slide, so this really shows how we use this device to engage with our patients. I'm a believer in if you communicate well with your patients, if you explain what you're doing, that improves compliance. I think we would all agree with that. But having this device, the patients have a better understanding of why we're debriding. They have a better understanding of the need for debridement if they see that bacterium. They then, as they come back, they know if the wound care treatment that we have been providing is successful. So with the device, it's very easy to show them a picture of or an image of the wound. And then after we scan, we share that scan with the patients. This is a direct quote from one of my patients. The images helped me to understand what was going on. After seeing the images, I understand the seriousness of my wound. On the next slide, so this is a summary. First of all, this has been now become a critical component of our limb preservation initiative and our wound care clinic. Because we're a government agency, we have the latitude, we don't charge for that. So in our clinic, essentially every patient has a scan on every visit. Again, that's not feasible for most clinics, but it's allowed us to gain a lot of experience with the device. With the device, we're able to get a digital image that goes in the patient folder. We get the measurements that goes in the patient folder. And we have the ability to have on the spot immediate detection of elevated bacterial burden in the wound. Putting that data together with our clinical assessment, then we make decisions about how we're going to treat that wound. So it's very easily incorporated into a standard clinical workflow. It does not take, you don't have to start an IV, for example. And in my opinion, it significantly improves our decision-making, and not to detract from the clinical decision-making, but this adds another data point that allows us to make on-the-spot critical decisions about handling those wounds. That ends the formal presentation. We have some time for questions.
All right, thanks everyone. We do see some questions coming in. So I'll start with one that just came in from Kim. It's, do different bacteria fluoresce at different colors, or do the different colors indicate a certain bacterial load? Dr. Andersen, could you address that?
Yes, very excellent question. So the majority of bacteria fluoresce with the red coloration. Pseudomonas actually is the other bacteria, and it has a different appearance. It has a smoky cloud appearance, so different than the majority of bacteria which fluoresce red.
And another question, so we have a couple of questions about transferring the photos from the device onto a PC and then interfacing with electronic health records. So I can speak to interfacing with electronic health records. There's specifically a question about Epic, and yes, the device and the images do interface with Epic. Dr. Andersen, could you speak to whether the photos can be downloaded from your device and put onto a computer?
Yes, that's a very easy thing to do. I can tell you in our clinic flow, the device will store, I don't know how many images, but we're continuing, and I don't know, we have probably 200 patients, and some of those patients have had 10 or so studies, so that it's very easy. And this is something that when you try the device or buy the device, make sure that you understand the feature of patient folders, because this, so we keep a log for what patient number, what their scan number is. So as soon as we see a patient, we go into that folder, and then we'll add that study to the folder. So right at point of care, for us, we can flip through that, we can show the patients, we can then certainly download that and put it in a medical record, but the ability to store those images and the fluorescence studies and the measurements in the device and refer to that. So when we pull up that patient folder, it's very easy to share that with the patients and make sure that we're making progress in the healing of that tissue defect.
Okay, thank you, Dr. Andersen. We do have some other questions which we will forward on to Dr. Andersen because unfortunately time goes very quickly. So unfortunately we're out of our time. But I do want to thank everyone for attending and remind that they can visit the MolecuLight virtual booth. It's in the exhibit area to get lots of additional resources, chat with the team there, answer some of the questions that you may have had about the device, about the reimbursement pathway for the device, and they can also arrange to, of course, book a demo of the device at their facility. Thank you so much to everyone for joining today, and thanks so much, Dr. Andersen, for being here.
Thank you, and thank you all the attendees. Have a great day.